So today we have the pleasure of being joined by Spence, a data manager at the Office of Public Safety for the City of Philadelphia. And Spence is a researcher and data analyst with special interest in youth policy and technology at the Office of Public Safety for the City of Philadelphia. Spence develops data tracking and governance systems, integrates programmatic data across multiple government offices, and visualizes and presents municipal data for internal and external entities. So that is who we have the pleasure of being joined by today. So with that, Spence, I will give it to you, to pass it along here.
Awesome. Thank you, Ashley. Let me go ahead and share my screen. All right. Are you seeing my presentation now, Ashley?
Yeah, awesome. It looks great.
All right, cool. All right. So like Ashley said, today we're mostly talking about using data to basically enhance public safety, right? And I'm going to be speaking a lot from my personal experience here at the City of Philadelphia, and kind of just like some things that I've learned along the way. In our relationship with Bonterra through Apricot, in our relationship with other departments throughout the city who are using either Apricot or similar software systems and things like that, and how we've utilized those to better track our incident response as an office. So a quick little agenda to orient today. I'll give you a little bit of my professional background. I always feel like that's a good idea, if you're listening to someone, to know where they're coming from and potentially what credentials they have to be telling you the things that they're telling you. So I'll share my background, and then I'll give some background on the Office of Public Safety here in Philadelphia to orient you to where we sit in terms of the city government. Um, I will also go into some problems that I identified upon coming into the Office of Public Safety and some of the things that we as an office have been working to mitigate. And then of course that leads to problem solving, right? So addressing those same points. And then specifically we'll go into kind of what we're here to talk about today, the incident response tracking. And we'll finish off with some tips and best practices that I've learned and my team have learned throughout this process. And then we'll leave some room for questions and discussion. But like Ashley said, feel free to ask questions throughout or make comments throughout. Doesn't have to be formal, right? And I know sometimes we leave questions till the end, sometimes we forget or we don't have time to talk about it. It's completely fine to ask questions as we go, and I'm fine to stop and answer them as well. All right, so just one slide about me. Sorry, I'm trying to move the little icon there. Okay. So I got my bachelor's degree in criminology and law, also a bachelor's degree in Spanish from the University of Florida. Go Gators. And then I moved on to get my criminal justice master's, and at the same time, master's in public administration from Rutgers University, the Camden location. And then here I am now trying to get a PhD in criminal justice at Temple University. Hopefully 1 year left, but we'll see how that goes. And so that's kind of been my academic career. And alongside that, at the same time, professionally in this field, I started as direct care staff for a juvenile residential facility. First worked in a female facility and then a male facility, and basically just the people that were like on the ground, keeping supervision, having to break up fights, that type of thing. And then in that same company, I moved up to a quality assurance manager, and that's kind of really when I started to get into data and see the impacts of it beyond just the day-to-day, right? And then through at Rutgers Camden, I was a research assistant at a research institute. Then I was a research associate at a Philly-based research and evaluation company. I have been a lecturer both at Rutgers and Temple in the area of research methods. And of course, now here I am as the data manager at the Office of Public Safety in the City of Philadelphia. And it'll be 2 years, I think, in May that I've been here. So, still relatively new, but also I've been in for a long enough time to like see these data systems develop, and I'll get more into that. That's just my background. So now getting into the background of the office, because everyone's office of public safety or criminal justice public safety department or whatever, everyone kind of structures it differently. I've learned. So for the City of Philadelphia, the Office of Public Safety, the main goal is uniting community and government to create safe communities, to reduce violence, to enact criminal justice reform, and support returning citizens. And of course, referring to citizens returning from prisons or other restrictive environments. So there's kind of a difference between us and the police, right? So a lot of people say like, oh, you work in public safety, you're the police, and that's incorrect, at least here. And in fact, we make a big deal to say like, yeah, the police are our partners sometimes, but we are our own entity, and that's we'll talk about later. That helps us get buy-in from the people that we serve, and so it's strategic that way. But the main difference between us and the police is the police focuses, of course, on the legal system, right? So arresting and like going through like the actual legal processes, whereas the Office of Public Safety, or OPS, as I'll probably be calling it throughout this presentation, focuses on intervention, prevention, responses to incidents of violence or other crimes or other community disruptions as well. So it's more that like preventative and intervention type of response. And here's just kind of a map of our office. So as you can see, there are 6 sub offices, and I know this kind of seems like a lot, but I promise I feel like it's necessary to orient you first to what we're talking about. So there's the Office of Public Safety, and then within the Office of Public Safety, there's the Office of Safe Neighborhoods, Office of Reentry Partnerships, the Office of the Victim Advocate, Criminal Justice, Town Watch, and the Overdose Response Unit. So our office is its own office, but it sits within the mayor's cabinet. So we have a lot of access to the mayor, and she has a lot of access to us. So it goes both ways, and it's pros and cons, right? Because it's we have like her ear, but then we also, we are very close to her, and she can ask us for anything, and we'll do it. But it's a relatively new office. Before 2024, it was called the Office of Criminal Justice and Public Safety, and it was located not in the mayor's cabinet. So there was a little restructuring that happened in 2024 with that mayoral election, and now we are our own office, but still connected to the mayor. And then, as you can see, within the offices, every office has an executive director and a deputy director. Not all of them have data staff, which we will talk about later. But basically, the offices can range in size from one office, I think, is just like 3 people to potentially over 100 people. So there's not every office is the same. They serve different purposes, but we're all under the same cluster. All right. So like I said, I started at the Office of Public Safety almost 2 years ago. And one of the main problems that I encountered, and honestly, that was introduced to me when I first started, was that our data was completely decentralized, right? And then also our capacity was very limited for data projects. And then the data that we were putting out, the data that we were collecting and analyzing was distorted. And so we'll get into that. All right, so kind of bringing back this site map here. So when I first came, the office and the sub offices were all using different data collection tools. And that ranges, as you can see here, from just Microsoft Office things, such as especially spreadsheets, right? That's like the basic, everyone has Excel, everyone has spreadsheets. We also use some Esri products like Survey123, Social Solutions. We did have some ETO in there. And then we also had some systems that were tied to the police or tied to the courts or tied to the prison systems that were not actually our systems, but we kind of like had some access, but not really, and things like that. all the way down to some offices were still just taking hard copy attendance notes on things, and that was the data, right? So a huge variation in the data capacity coming in. And I will note that the overdose response unit is our newest office that just joined the cluster a couple months ago. So they're actually not integrated into our stuff yet, and they weren't there when I first came. But that kind of has the same difficulties, right? Of like having office-wide statistics, having siloed data and operations, potentially missing opportunities for intra-office collaboration, right? So all the offices take different approaches or have different objectives, but potentially reaching quite an overlap of people, right? There's going to be overlap in who they're reaching, and if we don't know what everyone else in the office is doing, then we're missing opportunities to collaborate, right? And to help the people that we're trying to help. Or the opposite, where we're facing some oversight or missing out on opportunities, thinking that the other office has already contacted this person, and so we're not going to contact them, like, so that we need that centralization, right? So that everyone can see what everyone is doing. We're not having redundancies and we're not missing the people who need us. So capacity limitation was the next problem. And as we kind of touched on before, not every office has data staff, right? Not every sub office, I should say. So when I came, actually, none of the offices had data staff. We eventually introduced the data manager for the Office of Safe Neighborhoods, and she's been great. And then we started introducing data people for the Office of Reentry Partnerships, working with people coming back from prisons, and they've jumped on as well. And then, of course, now we have the overdose response unit, and that came with the data manager, so that's been great. But there's that question of what about the 3 that do not have data staff, right? So because of that, there's varying levels of data collection and quality, right? So what data is even being collected, and then how good is that data? How usable, how accessible is that data? And it leads to unequal executive and operational staff workload. So if there are no data people, but we're still requiring data from you, who's going to do that, right? And often it's been falling on to the directors of these offices or the deputy directors. And quite honestly, they have a lot on their plate, right? And a lot of times they are not themselves data professionals, right? So they're leadership professionals, they're business professionals, they're other types of stuff, but they have to carry it for their offices. And so of course that leads to a lag in data requests response time. Like I just alluded to, we are in the mayor's cabinet, right? And the mayor sees us as someone that she can ask to like pull up stats. And obviously as the mayor, and especially in a city like Philadelphia, you want to see crime stats. You want to see like, are shootings going down? Are we responding to shootings? What's happening with them? Are we seeing recidivism? Are we seeing the same people being arrested or showing up in these incidents every time? And that should come from us, right? Because like I said, we're the response. But this limitation makes us lag with that, right? And then so the mayor is having to like do a press conference, and we're trying to rifle through what we have and put it together and make sure that everything looks good. And so of course then we have like stunted data opportunities, right? So there are things that we could think about, like, oh, like how can we introduce like AI or other types of like software, or other kinds of like analysis software. But the thing is, like, even before we get to analysis, we need the collection, right? And we need to make sure that the quality is good, and that just requires, at the end of the day, more people or more staffing. So that's a limitation that we came up against a lot in the beginning. And then the third limitation, or the third challenge, I guess, that I identified was just data distortion. And that comes naturally from what we talked about before with the capacity limitation, because if some offices have data people and some don't, then when we report as an entire office, then it looks like some offices are doing more than others, right? Or it looks like, what's going on with this office over here? How come they're not doing this thing? Or how come they're not? So like the work that they're doing, like all of the good work, the street work, the talking to community members, the like going out to incidents, the, helping people is happening, right? But it's not being reflected. in the data, and that has ramifications in terms of budget, right? Or in terms of how we allocate resources or how we decide to staff different programs, right? So that's an issue. And it also leads to less targeted resource allocation, because if we're trying to target our resources based on the data, but then our data is not quality, then how do we know that we're putting our resources in the right place? Yeah. And then the last thing is public trust, which is huge, like I said before. Obviously, we're the Office of Public Safety, right? So we want the public to be able to trust us with their safety and to be able to trust us to give their feedback. And a lot of the people that we touch have been through a lot, have been through so much. And we don't want to just be another government entity or city entity that comes and asks things about their lives and like doesn't help, things like that. So we really want the trust to remain intact. And data is actually essential for that. All right, so we've kind of gone through the doom and gloom, right, and the negatives and our the work cut out for us, so to speak. So now kind of jumping to the problem solving aspect of it, and how we've gone about addressing some of those issues that we were talking about before. Yes. All right, so I know it's a lot, but it's just really just to show you the landscape of it. So we incorporated Apricot, which is Bonterra's case management software and data management software, when I came in 2023. And we started it basically, like, we started it when I came, right? So like I was new and Apricot was new. And so we were, just learning a bunch of things. And eventually we did onboard all of our offices onto the system, right? So that was huge for data integration. And I will say, with the caveat of not the overdose response unit, because they're still new. So that's up next. But yeah, we got the 5 original offices on, and full implementation honestly took about a year because of how much data backlog we had. We had the learning curves. We had to coordinate people's schedules for trainings, right? So we went through Treadwell, which is one of Bonterra's partners for implementation. We went through Treadwell, and our service consultant, Teresa. We all love Teresa. And she built it out for us. We like every office would meet with her every week or every other week or something like that. We just like pounded the pavement, and got everything in there. And like I said, each office does different things, but there are things that overlap, right? So the things that are highlighted here, like the participants especially, we wanted to make sure that we started working on shared forms and fields, right? So it's like everyone has somewhat of the same intake process. And so to make sure that we are not duplicating things or missing people or missing opportunities to connect, everyone uses the same participant onboarding forms, answers the same fields, things like that. Yeah, so that took a while, right? And you can see that there are a lot of data points that the offices collect individually as well. And we really try to centralize everything in there, right? So people sure can have their own spreadsheets and things like that, but we've been pushing for people to track all their data in Apricot so that we can have those office-wide statistics ready whenever we need them. And that's been great. So here's kind of an example of what our Apricot instance looks like. And I've obviously, redacted the personal information or sensitive information. So just some of the programs that we have in Apricot, because I should have mentioned, so obviously we have 6 offices, but within the offices, there are multiple programs, right? So there's a lot of nodes, right? A lot of cats to wrangle. So we have a lot of those in here already. And then this is kind of like what a participant profile folder would look like, where the participant's name is here, basically all the static information, right? And then you can see that, and this is a real record, this person is already is involved in 2 of our offices, right? And this is something that we might have missed before. But now that it's like centralized, like someone from ORP can be like, oh my gosh, like GVI, you saw this person 3 years ago. Oh, actually, they're actually still in your program. Can you tell me about them? How have you been able to reach them? Like, how have you been able to connect with them? What are some of the challenges that they've faced or that you've faced in working with them? How can we best help them? Things like that, have to facilitate those type of conversations to more holistically help our participants. And so the next thing was role definition. So because once again, limited data staff, um, we wanted to make sure that people knew what they were responsible for in terms of data, and that we weren't overloading anyone either, right? So obviously the easiest answer is just to hire a bunch of people, but obviously government, right? And bureaucracy and the slow turning wheels of the government. So we've kind of just had to determine how to break up the workload, especially for the offices that don't have data people. And one of the big things that we're kind of trying to push now is that directors and deputy directors like should not have the responsibility of being the data person, right? So that's a huge one, um, because they're already responsible for so much, and they're already in all of the meetings. And so if you need to ask them for something, they're already, like it just gets to be too much. And so we're kind of like trying to train interim data people until we can get some more permanent staff. We also do have a pipeline of interns and potentially working on grants to fund long-term data positions. So trying to get creative with ways that we're able to bring in staff, right, without having to do the whole bureaucracy dance. And then also in terms of role definition, we've tried to develop auditing schedules for the Apricot database. So whoever is the data point or data lead for that program, every week or every couple days or whatever, go make sure that people are filling out these forms like they're supposed to. Make sure that there are no duplicates in the system. And, thankfully Apricot has a lot of duplicate checks, but people know how to get around them sometimes, or people see that something is a duplicate and they don't want to wait for it to be checked. So they just kind of like change the name a little bit and get under it. And they say, we'll change it back once we figure it out, but then it doesn't change. So it requires some auditing, and honestly, it's understandable at the operational level. Like I said, I come from like a direct care operational level. Like when you're in the field, like you just got to get things in and you got to, you don't want to forget anything, but yeah, so that's why you should be able to lean on data staff to go back and check that for you. We're also looking for any missing fields or like empty follow-up. So if you check something that said that you're going to follow up with someone, making sure that you actually do. Because the software is great, right? But it still requires the human aspect, right? And making sure that operationally things are going as they should. And then we've also granted permissions within Apricot to their data staff, to our data staff to own their data in Apricot, to build reports even in Apricot, so that they don't have to lean on me or like any of their like more senior data people, kind of like empowering them to do it for themselves. And making sure it's a balance, right? Because we don't want to like overload them or like make their capacity, too strained. But for things that they want to learn or like things that they want to be able to report for themselves, like giving them the keys to be able to do so. And like I said, we're trying to expand the data team through interns. Um, Obviously, that one's kind of a band-aid solution, right? Because like interns are there for a semester and then you got to train someone else. But we do have a great relationship with the surrounding universities in the area. And honestly, a lot of people have even come from my program, criminal justice at Temple to intern here. So it's a good relationship either way. And then, like I said, directors, trying to keep them out of the data weeds, right? So that they can focus on the 30,000 foot level. And then we started trying to standardize reporting. So when we're looking at different levels of reporting, there's usually three that we consider. So individual, right? So the individual participant, so you have your demographics, that type of information. We also look at place-based data. So like in what areas are we having the most impact, or in what areas have we been deploying the most outreach? And the police will come out with a map of like the violence levels in different areas, and and do our programs line up with those areas, right? And then of course, incident-based reporting. So that will start with an incident, and then what did we do about it, right? Who was involved, where was it, and what was our response? Which brings us right into the incident response tracking. So this model is what we are aiming for now. And let me back up a second. So when we're talking about incident response, here we're supposed to be talking about shootings and stabbings. So this is our newest initiative that we've been implementing with our Apricot system. Last year was mostly about getting everyone onto the platform, kind of getting familiarized with the platform. And now it's like using it to our advantage, right? And trying to create maybe some dashboards or some automations so that we can be ready for questions that we're always asked as an office. So we're focusing on shootings and stabbings. Because as you saw, like potentially every office in our cluster plays a part in responding to these incidents, whether it's the people who go out there right away, or maybe it's the people who go out there like a week later to see what needs remain in the community, or it follows up with the victims and sees what resources they might need to be connected to. So the goal is to be able to easily track all of our incident responses under the corresponding incident, right? So right now, everything is kind of tracked. Everyone does respond to the incidents, but then if we're asked like, okay, what did OPS do for this? We still have to kind of go to every office and ask what happened, and still like define incident for them and things like that. So now this is the next stage of making that more cohesive, so that when the mayor or someone asks, we can easily answer. And also we can see for ourselves, right? See if our programming is what it needs to be, and it is what we say that it should be. So yes, this is the model that we're actively building right now and actively training for. So basically, we get incident reports from the police department, and that's always been a thing. And the designated person, which is usually the data manager from the Office of Safe Neighborhoods, makes a profile for that incident. So that's the incident profile here. And I'll show you an example of what it looks like in the actual system. And whenever offices do anything in response to that specific incident, they will just like link their forms, and everything will fall under basically this folder, right? So if anyone asks like, oh, what did you do for that shooting that happened on this date at this time? You just pull up that folder and you can open it and see we did all these things, right? And we can like build reports off of it. We could send, regular updates to whatever offices need them, and just make it a lot cleaner, right? So here's an example of kind of what this looks like. So if you remember before, the one that we looked at up here was the person's name. So now up here is actually the incident name. And in Philadelphia, and I don't know if this is a common thing with all police departments, but there's a district control number that all incidents are given. And that's what this is here. And it's just a unique ID for that incident. So we have the date, we have the time, we have like what kind of incident it is. We even have motive sometimes. So this one was a group, so potentially like a gang situation. We have programs that were assigned to engage with the incident. We have some general notes about the incident, and this is all stuff we get from the police and then from later narratives as well. We are able to link people to the shooting. So we not only have the incident level, but now we have individual level, right? And then once again, we see which programs are involved currently, or at the time, currently with these incidents, right? So it's like easy to just like open up the incident folder, see what it was, see who's responding. And even if I wanted to, I could click into the specific programs and see what their specific responses were, right? And like follow along with they followed up, or if they referred to someone else, and just track their whole progress that way. Here's another portion of that. So in the other slide that I showed, we were starting with the incident and adding responses. Now we're starting with the response and adding the incident to it. So for example, the Office of the Victim Advocate does crime scene cleanups. And they do crime scene cleanups for any incident that leaves any kind of bodily fluid around, I'd say. So it's not necessarily shootings and stabbings, but if it is a shooting or stabbing, then they will click yes, and then this little thing will pop up and say, "Hey, can you link the shooting or stabbing that you're talking about?" And and then that will put their response right under with everyone else's, right? And so it can be activated either way if you would do the incident first or if you do the response first. And that's just based on the office. So the Office of the Victim Advocate is just used to submitting these forms anyway. So I said, don't worry about it. I'll just add a little link. I don't want you to have to click on a bunch of other things. And then for some people, they like to do the incident first. But I think that that versatility has been really helpful in garnering the buy-in from our staff. All right, so this is basically like everything that we've been talking about here, but just like in like one graphic, right? So we're trying to look at individuals. We're trying to look at incidents. We're trying to track what programs they're coming from. We're trying to see like who was assigned to who was enrolled in what. And an issue that we've always run into is that an individual can be involved in several incidents, right? But an incident can have several individuals, and those individuals can be like it just gets very messy when it's not all linked together. And so like even in creating this graphic, it was like I don't even I had to remind myself even what I was doing a couple times. And that just shows like how messy it's been and kind of why this integration has taken the back burner for a while, because it's like, obviously we are dealing with real world problems and real situations and people in crises and things like that, to where it's like, we can't take a break and stop and figure things out like this. But now we can, and we have, and we're on our way to really making it a better data process. So but like now being able to go from an incident to knowing who was involved to taking on these individuals as OPS program participants and seeing how many programs they're involved with, things like that. It just helps to create a clearer picture of our entire data universe, right? Allowing us to identify like, oh, there's a gap here. We need to like add a resource here, or we need to add another link here. Or it may affirm what we're already doing. Like, oh, we have this many programs in the Northeast. It looks like the Northeast needs those programs, so we're doing all right. And if we, want to try to expand programming in the future, this is a very powerful resource to show what we're doing, right? So if we're going for funding, if we're going for grants, if we're going for, to hire more staff, to have this data under us to support and to show our point, has been really effective, honestly. All right, so I will end here with some tips and best practices, just some things that we've learned throughout this process. So number one, prioritizing data fidelity and security has been like the top thing, right? So data fidelity, so just how secure, how quality is your data and how consistently quality is your data? Because if you have a bunch of data but it's not good, or it's not clean, or it's not accurate, it's not usable, right? And all the good things that we just talked about like the granting and the expanding and everything, you can't support that, right? Statistically or like data wise, if you're trying to take a research evidence-based thing, right? So prioritizing the fidelity is important, and that comes with a lot of training. So training the operational staff, training even our data staff to know what to look out for, knowing what terms to put it in for operational staff. And then like the data security, right? So we deal with some data that is highly sensitive. For example, like juvenile data. And we've had to acquire a lot of like data licensing agreements and things like that to even house it in our system. And so like maintaining that security is crucial for obviously the safety of the kids, but also the security of our relationships with, the police or with whoever we're getting the data from, who's trusting us with the data. And then it's been important to develop these standards and definitions, right? So anytime there's been a break in our Apricot system, or we realize that there's been a trend of inputting things incorrectly, or we have to go back and change like a whole slew of things, we realize that whatever group it was didn't fully understand what they were supposed to actually be doing, right? Or we were saying the same thing but not meaning the same thing, right? So for example, I just specified that like when we're talking about incidents, in this case we're talking about specifically shootings and stabbings, right? And so we have to be really specific about it. But there are other things, for example, like even the word meeting came up. People have been tracking the meetings that they've been having in the community, and we eventually had to specify like, okay, were you holding the meeting or were you attending the meeting? And then does that make a difference for the program? And it actually does. And so now we need to specify like what a meeting is versus what a training is, things like that, where you like, it's annoying, but you have to get down to the nitty gritty, right? Or like, what is an intervention, right? Or what is outreach? Because some programs consider outreach to be going and doing a home visit, right? Or making a call. Some programs consider outreach if you're just if you're able to connect with someone on social media. Like if you're able to find someone on social media and like inbox them or DM them, they'll count that as like, all right, we checked on them, and like for whatever program that might work, but it's not universal. So things like that. Also in terms of like data fidelity, just even in the way that we create our forms and our fields has been really important. So for example, uh, using things like drop down options or like radio buttons instead of checkboxes or text fields, if we can avoid it, because we just want to keep everything standardized, right? So even in things where like we do work in different police districts, so we'll say like, oh, the second district or the third district, some people might be writing just the number 3, some people might be writing 3RD or spelling out the whole third. And then now on the reporting side, it looks like 3 different things, even though we're all talking. So drop downs, work out, or radio buttons where people don't type in their own things. And so then that goes into operational staff, as I was talking about before. I think a lot of times when data initiatives are implemented or are launched, they kind of stay at that data level, and then like the data people figure it out, and then they bring it to the operational people and say like, all right, this is what we're doing, and we want the report next week. And the operational people are like, this doesn't even make sense, for like what we're doing. And it becomes one of those things where it's just like, oh, the higher ups are just giving us something else to do, and like, the buy-in is not there, and it's just like, we already have so much work to do, and they do, right? So it's been really important for us to like, even when we have these preliminary database building meetings, to include some operational, at least like leadership operational staff, because it might work one way in my mind and it looks beautiful in the system and the data is all connected and everything's great. But then we might talk to an operational leader and they say like, hey, this person actually doesn't even have access to this, or like this person actually wouldn't even know how to answer this question, or this happens after hours. So what happens if, so-and-so's not available? And that's things that we just don't know, at our level. So including the people who are actually going to be collecting the data is very important. Because like I said, the data that you have, if it's not good, it kind of doesn't matter, right? And so that entry point is very important. And then I'd also say like automate or import wherever you can. So I know Apricot has a couple automation options, and we've utilized them a lot. And also some import options, because we had data systems before that just needed to come in, and those are huge import projects, and just being able to have that historical data in there as well for comparison has been great. And then the last thing I'll say is to pair the data that we're getting from incident response or whatever tracking that you're doing with other software. Like we do a lot of pairing with mapping. We use ArcGIS a lot, and thankfully Apricot stuff is usually easily exportable and then importable into ArcGIS. And we get maps like this, right? So over here is a representation of like all the shootings that happened last year, minus 2 years. So I think till October 2024. And then like overlaid on that over here is our incident response. And so it's really cool. And this is actually just one group's incident response. It's really cool because you can see that what you're doing is actually targeted to where the issues are, and so you feel validated, right? You're like, okay, we're reaching what needs to be reached, right? And we are, and this is something we can go to the mayor with, or we can go to, grant funders with, or whatever, and say, hey, we're seeing where the problems are, and we are actually going out there, and look how well it's lining up, right? So it's really encouraging for us to see things like this, and I think turning things into visuals like this is very impactful as well. All right, so that's the last thing from me. Thank you to those of you who came. We can all open it for questions and discussion. And as I am in Philly and it is Super Bowl week, I will say go Birds. Thank you.
Yeah, that's very appropriate. I forgot about the Super Bowl, but that is a very appropriate
Can't forget
response.
here. You can't forget.
That's fair. That's totally fair. Spence, thank you so much. This was such a wonderful presentation. Lots of great visualizations. Like I complimented you before, the presentation itself looked great, but lots of great visualizations and lots of great tips and takeaways as well. Something that comes up a lot of times with our speakers is removing as many like fill in boxes as you can with some reporting, because like to your point of,
Yeah.
hey, they might type in 3RD or they might type out third fully or whatever the case may
Yeah.
be.
Or
And
like
when you
lowercase, uppercase, like,
exactly, it can be really
yeah.
sensitive. So when you just have
Mhm.
those drop downs, it makes everything much clearer.
Right.
So yeah, thank you, Spence, and thank you
For
everyone
sure.
here for your time and attention this afternoon. If you have any questions, we'll definitely take them. Feel free to put those in the Q&A, like I mentioned earlier. But before we transition to that, folks, if you do have any questions specifically on some of these screenshots that Spence showed, and Bonterra's tool Apricot on how we can kind of help you standardize that data, make your data more reputable, more reliable, feel free to fill out this poll I'm going to launch again here. And we'll kind of initiate those conversations once we wrap up here with someone from my team to talk through what that might look like for your organization. But while folks are filling that out and filling in their questions again, yeah, Spence, this was very great. This is great. And I feel like I have such a great background on the city of Philadelphia and how your public
Good.
safety does. Lots of good background that definitely provided the necessary context. So
Right. I had to frame it for you.
exactly, no, definitely took us through that journey, which is always appreciated. But yeah, while folks are filling that out, it doesn't seem like we have too many questions coming through, which to me always means that you did such a great job presenting that there are no
I'll take
questions.
it.
You're left with no questions. You answered everything. I can't ask anymore.
Like it.
Awesome. Perfect. Well, again, folks on the line, thank you for your time and attention this afternoon. Thank you for joining us. Thank you, Spence, once again. And we really appreciate your time, and we appreciate you speaking with us this afternoon, Spence.
Thanks, Ashley. Thanks, everyone.
Awesome, folks. Well, we hope to see you at our next session. And like I mentioned earlier, we did record today's session, so we will send that out to your inbox sometime next week. So again, be on the lookout for that. But until our next session, have a great rest of your afternoon, and we'll see you at the next one, y'all.
See ya.
Bye, everyone.